biceps, my pectoralis major, anterior deltoid, and coracobrachialis. And then the abduction, we talked about 0 to 15 degrees is your supraspinatus, then is the 15 to 90 is your deltoid, and 90 degrees is where the scapula gets rotated, right? This is done by trapezius and serratus anterior. Adduction produced by the contraction of pectoralis major, latissimus dorsi, and teres major, and we talked about medial rotation, internal rotation, contraction of subscapularis, pectoralis major, latissimus dorsi, teres major, and anterior deltoid. Lateral rotation away from the midline, right, produced by the infraspinatus and teres minor. So, somebody comes with neck pain. What do? Step 1, we understand the anatomy and the direction of the muscle fibers, right? So for the neck pain, what is involved? You have the splenius capitis, very important muscle for the extension, You have the trapezius, again very important for the extension. You have the rhomboides minor, rhomboides major, because it is connected to your, the upper part of the thorax. Then you have the occipitalis, and you have the scalenes posterior, you have the scalenes medial, anterior, and also the sternocleidomastoid. So these are the muscles that you have to look for, especially when we check for neck pain. And what we do, we ask the person to sit, and this is the direction when we go for middle trapezius. We check for trigger points, and if there is a trigger point, we do ICT. Then we go to rhomboids, we check for trigger points, we do ICT. And then we check for trigger points in the splenius capitis, right? And then trigger points and the trapezius and the scalenes. And once we do an ICT on all this area, because we are mostly covering the agonist, antagonist, the entire group of muscle, we are just finding where the trigger point is, and we are, eliciting it, and we are then releasing it. Again, searching for trigger point in the next muscle, and then you're releasing it, right? And then you just massage the area generously to get that, tightness off. And then with the patient supine, stand on opposite side, and then you just do a dragging massage to get all that muscle in the neck relaxed on both sides. And then finally, like I said, the occipitofrontalis, this is a very important muscle. We talked about that point in when I was showing the Marma slide. People, sitting job continuously, tension, headaches, this is the area that you have to look for, right? Very important in marmology. And in shoulder pain, what do? We study, again, we do the same thing. We study the anatomy and direction of the muscle fibers, right? And understand the muscle that is involved. And we discuss about the extension, flexion, all those actions of the shoulder joint. And then we're going to understand which muscle is involved, and then we're going to treat it, right? Then we do sitting ICT to the supraspinatus. This is how we use the elbow. Upper trapezius, I've shown you, you just in that video. And then this is the position for the deltoid. You're just going to ask the person to lie down, and then you're just going to stroke, and you're just going to find a trigger point, and then you're going to just pause. Teres minor. This is a very important step in teres minor, because we sometimes miss it. The teres minor muscle, it is on the lateral border of the scapula, right? So it lies somewhat like this, the teres minor muscle. And you will be able to miss the trigger point only if you make the patient to lie down laterally, and then you ask the patient to put the hand in front like this. so you can this area. This is, very important area, especially, you'll have a lot of people having pain in that area, pain and stiffness. We don't really understand it. We don't really reach this point even in massage. We kind of, because your hands are like this, you just go on the back. There is a more chance of missing this area when you're doing a massage. So you have to be very important, and this is very, 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 very major. A muscle when you're talking about trigger points in the back that is affecting the shoulder joint. The latissimus dorsi is also, it passes like this, posteriorly, right, like that. That's the latissimus dorsi. Then you have the teres majus. So these two muscles, we generally miss during the massage, etc. Next, once you do for deltoid and then do for teres minor, then you for pectoralis minor, very important, and infraspinatus, right, for the trigger point of the back. And once we do the trigger point release, once you do the massage, the next thing is do stretches. Now you can imagine the possible, muscles that are involved when you do, example, like a towel stretch, like a flexor stretch. This is very important, very good, especially for the trapezius, especially for, all sort of neck pain, shoulder pain when people come to you. I usually do a trigger point release. I give internal medicines and I ask them to do Abhyanga itself, and then I ask them to do stretches every day. So this kind of helps in, for the recovery faster. And then you have the next stretch, right, to stretch all this area. So what do? You look to the left side, a 45-degree angle, and then you look as if you're looking into your pocket, right? So when you do that, that is how you stretch this entire area. Very useful stretch, especially for trapezius, for the neck. So cervical region, what do you do? So you ask patient look 45 degrees, then you do look into the pocket, right? When you look into your pocket, you can see the stripe. The other way of if you want to do an added stretch, what you would do is you would take your hand, you put it at the back, right? And then you want to stretch this area, then again you will do like this. That is one. If you want still a bigger, better stretch, you can just so if you feel that you're not stretching enough, you need more stretch, so you're going to take your hand to the back, right? Just going to do like this, and then you're just going to use your finger, and then you can see, you can feel that stretch in that area. I hope those who are seeing are doing it, because none of the videos are on. I don't know if you're seeing it, but that's all. Was that clear? That stretch is very important. The flexor stretch and also the neck stretch. These are the extension of it. The basic one is like this, the extended one is like this, and then another one is like this. And you can just do it both sides. Good. I hear a message. Yes, we can feel the stretch. Great. That's about it. Practice on yourself all these stretches. It's all the anatomy should come into your mind. What are the muscles, and when you're doing this kind of stretch, I can feel the stretch in my trapezius. I can feel the stretch in my levator scapula. I can feel the stretch, in my scalenes. Right. When I add this hand, there is more stretch in this area. Right. So you don't have to remember the name of the stretches. That's why. But you need to, if you can remember the name of the muscles, right? You just need to explain people. You need to show them the stretch. See, can you feel the stretch? You have to stretch. Sternocleidomastoid, right? Very simple, straightforward. I talked about the special stretch in the sternocleidomastoid with the sternomastoid and cleidomastoid separately. I'm sorry I couldn't upload the video on Facebook. I will do it today itself or tomorrow. Please give me. You can just go back there because that stretch is more effective than, because here you're just doing when contracting and relaxing both the sides, right? But the one I mentioned was about stretching particularly. So when I do to stretch my right side sternocleidomastoid, right? The sternomastoid, the function is when I contract, the head moves that way. So this is the contracted state of my right side. To relax this part, what I do stretch, right? Stretch. And if I want to do my cleidomastoid, this is the stretch, right? So you have people coming to you, they say that they're very active and they do a few stretches in the morning, and we ask them what are the stretch they do. They like, this is the stretch. This is that's stretching from most. But no, when we need to take the stretch into all those points where all these muscles are doing proper stretching. So when you do proper stretches, there is lymphatic drainage, so you won't get this stiffness, congestion, stagnation in this area. The most important area in the year 2021, because everybody is sitting at home. This area is being, tortured, overused. Unfortunately, not many people know how to protect it, right? Next is the neck isometric. We talked about isometric contraction, where the length of the muscle fiber does not change, but there is a contraction, right? The best way to understand what an isometric contraction is when you know what is a tug of war. I hope you know what is a tug of war. I don't know what you call it in Hindi. Doctor, do you know the game? It's called tug of war. Malayalam, it's called Vadamveli. In Hindi, I have no idea. So it's basically when two teams, they stand on both sides, and there is a rope, right? And they pull both the ropes, and there's a flag, and then the winner is decided when the flag moves a certain line in them. So, and can someone respond? Are you able to understand what that game is? Somebody who knows Hindi?
Yes, sir.
Doctor, is there a name for
Tug
that?
of war.
Yeah, is there a name for it in Hindi?
Rustic Hedge.
Okay,
It's
Rasik.
Rustic Hedge. Yes, and in the movie Bahubali, we can see that in the starting when
Brilliant.
Bahubali entry of Bahubali.
Yes, 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 yes. But Bahubali was not doing isometric stretch, so Bahubali was doing more like a contraction, right? So the isometric stretch that I wanted to explain is in the game of tug of war, what happens is both the teams will just lie on both sides without nobody actually making major movements, right? The entire muscle of their body is all contracted, but it's not moving. There is no length, and that's called the isometric contraction, right? So I just want to talk about isometric, and then this chin tuck again is a very important, must what do you say, stretch. So what you do is you ask the patient to move the head back and forward, right? Chin tuck, very important. To get that movement in your cervical spine. Next. So I hope all understood. This is how we understand the basic trigger point therapy. We do treatments and then we do stretching. We understand. Now, thankfully, there is something that is called as super trigger points. Now, super trigger points are those set of points that is most commonly seen in the human body. So you can begin your journey of trigger points based on these trigger points first. Just thorough these trigger points because all the cases will be classified under this, right? You have the scalenes, you have the biceps brachii, you have the patellar ligament, you have the extensor digitorum longus, right? The area that you see is the area where there's trigger points and when there is, pain on the and you have the sternocleidomastoid associated with headaches. You have the scalenes, hand and wrist pain, neurovascular problems, right? Ligamentum patella and knee pain. You have the extensor digitorum longus at the junction of the talocrucal joint, ankle balance, post rupture, and ankle pain. Very important. The extensor digitorum longus is something that gets overstretched or used when there is a supination trauma or like a sprain or what we call if there is a fracture, right? And mostly the trigger points, especially the fracture of the ankle joint low, sprain, people will be in what do you say, POP for a long duration, and most probably the trigger point will be formed in extensor digitorum long. And what that does is it causes the instability of the ankle, pain in the ankle, people sitting continuously in plane or traveling in train, they come with edema. You can see it's because of the lack of stretch or the movements in the extensor digitorum longus. Next, on the posterior aspect, the most important ones are the infraspinatus, gluteus medius, and the popliteus, right? Infraspinatus, near medius scapula, right? Subscapularis and long head bicep brachii for shoulder pain. You have the popliteal area for knee pain. It's very, 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 very important. If you learn to release the the popliteus, the pain, people will be so happy because there is so much of tightness and stiffness in the joint, and there is an immediate relief. Then there is gluteus medius for lower back pain, right? So these are called as the super trigger points. Make a note of it. Try to learn these points specifically first. Once you're thorough with this, then you can see that most of the cases that you see in your clinics, you're able to handle. So when you talk about the super trigger points, what are the conditions or the symptoms that they have. You have the sternocleidomastoides for headaches, vertigo, right? You have the scalenes for hand and wrist pain, neurovascular problems. Infraspinatus, you have the shoulder pain, gluteus medius for low back pain, ligamentum patella for the knee pain, popliteus knee pain, extensor distal longus for the ankle pain. So, I had said in the earlier class today, in the session, at the beginning of the session, like once we start learning these trigger points and once we start learning, how to treat them, while we are palpating it, and you can feel the different the connections, interconnections in the body, right? And the most brilliant study about these connections or these fascia is done by Thomas Myers, and it's called the myofascial meridian, right? So I just wanted to get you all introduced to this as well, because it is very important in understanding these connections. And when people say that, I can feel the pain here when you're pressing there, and vice versa, you should understand probably this is the connection, right? All those who have done the art of cupping, the cupping webinar, I'm sure you've already seen it. So it's a refresher again, but this is in the view of trigger points, right? So trigger points tend to emerge along 7 predetermined lines of force of meridians, and the concept of myofascial channels, it's called the anatomy trains. It's done by Thomas Myers, right? Very, very interesting work. There's a lot of YouTube videos you can just, and the sports world actually lives by it. The new physios, the osteopaths, this is the latest sensation, because you're getting a lot of answer in this, right? And the meridian maps may help to explain why there's development of primary central trigger points in one area of the body may lead to secondary or satellite trigger points in another area, which means you have pain in one area, and then when you press, there is an association in another area as well. So we'll just talk about the basic thing. I'm just going to run. I'm just going to, I will share a PDF where you can learn in detail, right? But we need to understand why it is important, because these are the relevant cases that comes to your clinic, right? The superficial front arm line, it's formed by the latissimus dorsi, inserts at the bicipital groove along the pectoralis major. Meets the medial intermuscular septum along the humerus. The common flexor tendons that originate at the medial epicondyle of the ulna through the carpal tunnel and ends in the insertion to the palmar surface of the finger. So, very important. Can somebody say the condition that we see in today's world based on this, the myofascial, the superficial front arm line?
Correct. Last Saturday I had one patient. He is by profession he is a chef, and approximately 4 to 5 hours a day he is chopping onions. So he came out with a complaint of he was not having any strength in his digit. He was not able to cleanse, or he was not able to make any movement of his wrist as such. So while checking, I found the trigger points in his deltoid region, in his biceps, and on releasing those points, he was able to, his strength increased actually. So in his fingers.
Okay.
Initially, what he was having locally, the problem was there in his, I think it was his left hand. Yes, in his left hand, fingers. There was no strength as such, and he was not able to close his fist completely.
Okay.
But then after pressing down the trigger point in the upper back region and upper arm region, he was able to, he felt like he has gained his force as such.
Okay, brilliant. So that is excellent. The condition that you're talking is when this person cannot hold anything, right? So his extensor group of muscle is affected because the flexion is okay, but the extensor group is not relaxing. There is stiffness, and that's why he can't. So when you talk about the extensor group, right, it comes right at the back. So uh, I believe you did the deltoid and the biceps, right, doctor? Or
Yes, sir. Yes, sir. Yes, sir. And then I came.
did you check for
Yes,
bigger
sir.
points in the upper back?
Yes. I did go for upper back also, and I
Wait,
did apply cup also. Cupping. I also did cupping in upper back.
okay, great. So we'll talk about that in the next myofascial meridian. But this is the superficial front arm line. It is coming from the the chest region, right? Right to the bicipital groove, to the flexor groove, right, and to your wrist here. So, is there a condition that you feel, a very common condition that you see in today's practice?
Picking up weight. Picking up weight.
No,
Excess of weight.
the name. Okay, I'm looking for the name of a condition, doctor.
DQT, sir.
I'm sorry.
DQT.
No, it's not decubitus synovitis because that happens on the thumb part, right? This is more like the anterior when the it's happening this side. Yes, I'm looking for names like that. You said DQT is good, but DQT is not. DQT is here, right? It's for this decubitus and anyway, last guess. 10 seconds. Okay, let's see if we can give a clue. What is probably the structure that is affected there? What is a common condition that we see nowadays? I didn't hear, doctor.
Carpal tunnel.
Brilliant. And here?
Tennis elbow and
Tennis elbow.
elbow.
Okay, so close, but this is actually golfer's elbow, medial epicondylus, right? This is the carpal tunnel syndrome. Now, if you notice that, when we talk about carpal tunnel syndrome, the reason for it, what many people say is what is the reason for carpal tunnel syndrome?
Median nerve compression.
Yes, and due to which job that we see, obviously. Okay, so I don't want to confuse you. Okay, there is a compression, and today many people say that it's mainly those doing continuous typing work, right? Like on the computer. Isn't that the main reason what people say carpal tunnel is due to?
Lying down with the hand, keeping the head over the hand in that position and lying down. That is also one condition which people are saying, like apart from
like this.
Side. Yeah, like that.
Okay. So yes.
Like this?
So okay, good. So this is what happened now. Many conditions, what happens is, you're going to see people coming to you into my clinic, when if you ask them, like, you mentioned, they don't put their hand at the back and sleep. They don't use computer. They don't use typing. They're just normal housewives